Hi, my name is Jen. I'm a registered nurse here at Fox Valley Plastic Surgery in Oshkosh and Appleton, Wisconsin. And I'm here today to talk about our semaglutide weight loss program. We have always had a medical weight loss program here at Fox Valley Plastic Surgery. We find that our plastic surgery patients just have better outcomes when they are at their ideal or goal weight. So we were really excited to bring the semaglutide on as a great option for our patients. So we're just going to talk a little bit about that today and give you a little bit more information. Semaglutide is the generic form of Ozempic. It has been FDA approved for weight loss. Patients treated with Ozempic or semaglutide lose between 9 and 13% of their body weight over the course of a year. So it is a slow go. 1 to 2 pounds a week is considered healthy, sustainable weight loss. And there may be weeks that you don't lose any weight at all, and I will get into that later. We compound our semaglutide in a compounding pharmacy. It is not compounded with any sodium, L-carnitine, any type of vitamin B at all. It is just a straight semaglutide, and we are not taking from diabetic supply. So some of the contraindications to semaglutide would be any family history of medullary thyroid carcinoma, any personal history of pancreatitis, gallbladder issues, kidney disease or injury, increased heart rate, low blood sugar. So any of those, we would say that you're not a good candidate for it. Let's get into how the medication works. The way that this medication works is by really suppressing or controlling your appetite and also delaying gastric emptying or really slowing down that GI system or digestive system. So the two main side effects that we're going to see with this medication are going to be nausea and constipation. There are other side effects, and every patient is going to experience varying degrees. Other side effects can include abdominal pain, vomiting, diarrhea, bloating, burping gas, acid reflux, headache, fatigue, but the two main ones are going to be nausea and constipation. The nausea we typically see wanes after a day or two of injection, or after we tick up your dose at any point during your treatment. Nausea is typically going to be quelled a little bit by making sure that you're eating slowly, really slow down your eating. Your belly sends a signal to your brain that you're full a lot quicker on this medication. So we want to make sure that you are eating slowly, but that you are eating something throughout the day. If it is 3 p.m. and you haven't eaten anything all day and you do feel nauseous, you want to make sure that you've eaten, because that's likely the reason why you're nauseous. Next, we're going to talk about constipation. That's the other big side effect on the semaglutide. Not everyone will experience constipation, but most of our patient population will. If you are chronically constipated to begin with, you may find that you need a little bit more help to go. So we're going to suggest that you try over-the-counter Citracel, Metamucil, stool softener, magnesium, things like that. And it may take you a week or two to figure out what's going to work for you. Obviously, don't treat for constipation until you experience constipation. You could be one of our patients who goes the other way and experiences diarrhea. But we just want to make you aware that that is one of our two top side effects of the medication. The biggest takeaway with the semaglutide is that it is not a magic medication. It is a tool like any other weight loss tool that can help you to get to your goals. So you want to make sure that you are not relying too heavily on it to lose weight. Nothing about this medication is making you lose weight. It is giving you that appetite control and appetite suppression and delaying that gastric emptying to make you feel fuller longer, and that is what's helping you achieve your goals. So we want to make sure that while you're on this medication, you are focusing on a healthy diet and healthy exercise. Those healthy habits will sustain you through your course of the medication and help you maintain your weight loss after you come off of the medication. So really what we're telling our patients is get to a point where you're happy with your weight loss, and then what we would do is sort of wean you down off the medication. when you come off of the medication, that hunger is going to creep back up. So we want to get you to a point where you can acclimate to that hunger coming back so that you can maintain those healthy habits that you hopefully have put into play throughout the course of your treatment. So how do we dose the medication? We have found through just kind of researching other practices and what they do that starting off at too high of a dose can lead to some significant side effects. We typically dose our patients at around 6 units on a diabetic insulin syringe, which equates to roughly 0.25 milligrams of the medication. So we're starting you off at a very low dose, and we're going slow with that dosing. What we find is if you are achieving good appetite control with minimal side effects on that lower dose, we do not need to increase that dose. Your body will naturally outgrow that dose and will address it at the time to increase your dose. But if it's not broke, we're not going to fix it. We're going to keep you at that dose that is going to give you that appetite control for the week with minimal side effects. So it's important to note that an increase in dose does not equate to an increase in weight loss. An increase in dose is only going to equate to an increase in the likelihood of side effects. So what we have is a weekly check-in procedure that is a requirement on our program. We have a secure text line. If you're texting us through your phone that we have on file, it is going right into your chart. There is a nurse daily that monitors the text line, and we want to know a few things from you. We want to know what your weight is, how your side effects were the week prior, and how has your appetite control been. Those are the pieces of information that are going to help guide us on your dosing. It is not one-size-fits-all dosing. So if you're telling me that your appetite was well controlled through that first week with minimal side effects, we are keeping that dose the same. You are getting the benefit of the medication, all it's supposed to be doing, and with minimal side effects, and that's our goal. If you're telling me that your appetite was only controlled for a couple of days, again with minimal side effects, we may bump your dose up a little bit to see if we can extend that appetite control through the week. If you're telling me that you were vomiting for 5 days but didn't really feel much else, we're not going to advance your dose. We want to get those side effects under control. So really important pieces of information for you to give us so that we can get back to you and let you know what your weekly dose should be going forward. And we want to hear from you on a weekly basis. So once you kind of check in with us weekly, a nurse will get back to you. We are not in front of the text line all day long. We are, kind of checking in between patients, so it may take a few hours for us to get back to you, but we will get back to you by the end of the day. And we ask that you check in 2 days prior to your injection day so that you have plenty of time to plan for what your dose is. We get a lot of questions on people who maybe aren't losing weight or are plateauing with their weight loss. And plateaus can happen in any weight loss program. And the way we're kind of looking at it is if you're getting good appetite control on this medication and you're not losing weight, you kind of have to look at what you're doing at home. Are you eating the right things? Did you go off the rails on the weekend? Did you make some bad choices? We can absolutely out-eat this medication. You can out-eat a gastric bypass surgery. So it is absolutely feasible that you could be out-eating the medication. So if you are hitting a plateau on the medication, we want to kind of make sure that you're looking at what you're doing at home as well. This med takes you sort of half the way there, and then really you're responsible for taking yourself the rest of the way there. So here at Fox Valley Plastic Surgery, we're a little bit different than some of the other practices in the area offering this medication. We don't do monthly subscriptions. We don't just give you the medication and kind of let you go on your own with it. We want to check in with you. We want to hear from you weekly to make sure that this drug is going well for you. This is a potent drug with potent side effects, and we want to make sure that we are in pretty regular communication with you and can monitor your progress throughout your treatment. So we offer pricing per vial of medication, and that is how we run the program here. It is not a monthly subscription. We are charging for the medication. So you get a vial of the medication, and there's about 100 units of medication in that vial. We are starting you off at about 6 units. Again, like I said, that 0.25 milligrams. And depending on how quickly you need to advance on that dose, the vial should last you between 2 to 4 months for most patients. Again, everybody is going to be different depending on how they're responding to the medication and how quickly we need to advance their dose. So when you sign up, we do give you a binder with information, and we also give you a log to keep track of your dosing. So if you're keeping a good log of what your dosing was weekly, then it's easy to kind of figure out how much of the medication you have left in your vial. Again, we're starting you off at 6 units, and there are 100 units in a vial of medication. So that was just a little bit of basic information about semaglutide and our semaglutide program. If you are interested in learning more about it, you can go to our website. You can also find updated pricing information there. And if you're interested in a more specific consult, you can give our office a call and come in and meet with one of our nurses. So thank you so much for watching this video, and I look forward to seeing you.